social interaction. Because when a child is autistic child, the major challenge which parents face is that the child is not interacting with others, the child is not doing eye contact. There are various other problems also which autistic child has, because autism is an umbrella kind of a term. There are so many other problems which come under this umbrella. For example, ADHD also. There are various autistic children who are also hyperactive. Hyperactivity is evident in many autistic children. Then there are various milestone delays that are evident. There are various complications which are there in autistic children, and it won't be wrong to say that the biggest challenge, even more challenge than autistic children, is for their parents, who have to really put in good efforts to make the child understand things and make the child self-sufficient for himself or herself. If we talk about the reasons, there are not many obvious reasons that the allopathic world is able to give for autistic child. There are conditions like various syndromes like Down syndrome and others in which the child may be developing autism. There are certain brain conditions where the child is delayed to maybe where it may develop. But there are many cases where there is no such thing and still the child is autistic. When we talk about autism, there is not much that allopathic medicines can do in such a child. Apart from controlling of hyperactivity with some medicines, which again are not safe for long-term usage, there is a lot of psychotherapy that can be done in such children, like occupational therapy, speech therapy and others. But then, the treatment options, they are not much in allopathy. And it's here that Ayurveda comes to rescue. When we talk about autism, Ayurveda definitely is the most preferred system. And that's why I did the research with the topic, a role of Ayurvedic herbs in psychogenic disorders. And have been dealing with such autistic children since past 21 years now. In Ayurveda, there are two kinds of herbs. One are Medhya, another one are Sangya Sthapan. We use both these herbal combinations in a very good manner, in a very technical manner, so that both the goals in an autistic child, that is, managing the current situation. For example, the parents are coming to us and telling us that our child is hyperactive. We need to reduce the hyperactivity. The second thing, for example, if the parents say that our child is not speaking and we want him to speak, we want him to interact socially, making those things happen in the child, we are able to show those stages in the child with the help of these unique combinations. Acharya Charak, one of the most renowned ancient scholars of Ayurvedic medicine, says, Manduk Parnaya Surasa Prajya, Shirene Esti Mudukasya Churnam, Raso Gluchastu, Sa Mool Fal Pushpa Khalu Shanka Pushpya. Manduk Parni, that is Central Asiatica, it's Swaras, extract, juice. Shirene Esti Mudukasya Churnam, powder of this rice glabra with milk. Raso Gluchastu, Thymospora califolia's juice. Sa Mool Fal Pushpa Khalu Shanka Pushpya. Convolus is a plant Shanka Pushpi. The Pancham, all parts of that can be used as Medhya signs. So these are four things which can be used in any autistic child without fear, and this gives a very good recovery. Along with that, for the children, we have divided the Medhya and the Sangya Sthapan into two unique combinations, Breno A and Breno R. Both are in syrup forms, very convenient for a child to be taken. So you can use this in accordance with what a doctor's guide for your child. Along with these, there are certain guidelines like application of special medicated oils on the scalp of the child, making your child meditate. It's not easy for an autistic child to be guided for meditation. But all that you require to do is ask your child to close his or her eyes like this and incentivize the child if he or she closes her eyes for longer duration of time. Slowly and gradually increase the time frame for which the eyes are closed by the child. Another thing, whenever your child is to sleep, you should lower down the head end of the child a bit. For this you can, by some means like putting up a brick under the bed on the foot side, you can raise the foot end a bit so that when the child sleeps, more blood circulation is there inside the head, helping it to develop in a better way. A third thing which can be done is there are Ayurvedic medicated oils, drops of which can be poured to the nostrils of the child. These are some of the things. Then there is Panchakarma, various Panchakarma therapies which are very good for such autistic children, and n number of other things which we have developed slowly and gradually for such children, helping them to very soon enter a normal life, a near normal life, and give the maximum improvement possible in such children. Autism is a temporary phase in the life of a child if treated timely.
Another recovery story of autism treatment. Patient name, birth age, 3 years old, disease. Autism, chief complaints, speech delay, hyperactivity, irritated behavior, less interaction, less understanding. History of patient. The parents of the child consulted Dr. Navdeep Sharma on July 2023 at 1:09 p.m. and felt the scope of treatment to work for the child. He didn't respond clearly and showed irritable behavior most of the times. He had less understanding of things and remained hyperactive within 9 months of undergoing treatment from Dr. Navdeep Sharma, or showed significant improvement. He became active and listened and understood things. He got indulged in activities. His hyperactivity reduced and he also started speaking words clearly. He became more interactive and his irritation also reduced significantly. He voluntarily participated in things like eating his food by himself.
हेलो पेरेंट्स, पार्थ हेलो करो, हेलो करो। ये पार्थ है, मेरा बेटा 4 साल का होने वाला है। लास्ट ईयर जुलाई में हम डॉक्टर नवदीप शर्मा सर के यहाँ पहुँचे थे। मेरे सर ने मेरे बताया था सर के बारे में। हमने सोचा भी नहीं था कि आज 9 महीने में पार्थ मम्मा पापा हमसे बोलेगा इतनी जल्दी। तो मतलब थोड़ा पेरेंट्स के लिए कहता है कि कब मम्मा पापा सुनेंगे पार्थ के मुझे। आज पार्थ मम्मा पापा और बिग फ्रेंड्स सब कुछ बोल रहा है। भगवान की कृपा से और सर की मेडिसिन और सर की गाइडेंस से आज 9 महीने में पार्थ एक नियर नॉर्मल लाइफ जी रहा है। और स्कूल में भी पार्थ के ग्रुप में था। अभी जस्ट 15 दिन पहले स्कूल में मैम ने बोला कि पार्थ को नर्सरी में भेजेंगे। और जो सर ने जो लाइफ में हमारी खुशियाँ दी हैं, बहुत पेरेंट्स के लिए इससे ज़्यादा और क्या हो सकता है कि उसका बच्चा इतनी जल्दी और इतना अच्छा इम्प्रूवमेंट हो जाए, एक पेरेंट्स के लिए बहुत बड़ी बात है। थैंक यू सर, थैंक यू वेरी मच हमारी लाइफ में इतनी बड़ी खुशियाँ देने के लिए। थैंक यू एंडी।
Thank you. Our team of experts of psychology. Our team of Panchkarma experts. All now to the connect with world's senior most Ayurvedic healer, Dr. Navdeep Sharma. Gift your child autism-free life. आज ही संपर्क करें विश्व प्रसिद्ध आयुर्वेदिक विशेषज्ञ डॉक्टर नवदीप शर्मा जी से और अपने बच्चे को ऑटिज्म मुक्त जीवन का उपहार